Dear Muslim sisters and brothers, I am Dr. Madhavan, cardiologist from Madurai. Ramadan is the holiest month for Muslims. It's a month of patience, kindness, and charity. And of course, fasting is the foremost important duty of every Muslim friend. As a cardiologist, I come across a lot of patients with high blood sugars, high blood pressures, and kidney patients. They insist upon fasting, even though their health conditions may not permit them to undergo fasting during Ramadan. When they are very much interested, I encourage them, go ahead and do fasting. However, I insist on certain tips what they should follow during the month of Ramadan, during fasting. So, what are the risks that can happen during the prolonged fasting for 1 month? Because from the sahar in the pre-dawn time to the iftar before the sunset, there are 14 to 16 hours that you friends are not eating or drinking or not even swallowing your saliva. So the risks are dehydration, because your blood vessels are empty with blood fluids. It's without water content, adequate water content. So dehydration is one problem. And low blood sugar. Low blood sugar happens maybe in the morning hours of fasting or in the evening hours of fasting, and high blood sugar happens after the iftar. After the iftar, when you break the fasting, you drink juice and some food, and at night time if you have a very heavy dinner full of carbohydrate, let us say biryani or rice, your blood sugar tends to go high. So that's where high blood sugar happens. So the problems are dehydration, low sugar during the daytime, and high blood sugar during the night. And what all things can happen? Because of the low sugar, you may have giddiness. Because of the high sugar, very high sugar, more than 300, 400, 500 milligrams, you can have something called ketoacidosis, which can lead to coma. So how to avoid all the problems? Number one, during the sahar, the very early morning after your prayers, when you have food, you should have a complex carbohydrate, which means it's not just the rice. You should take a lot of millets and pulses, nuts, and of course along with rice. So this complex carbohydrate and proteins stay in your body for longer time, so that the blood sugar level doesn't go down drastically. It stays in a plateau stage over the period of time. So you have to take complex protein and carbohydrates in the pre-dawn time, that is before sahar, and after iftar again you should take, because after iftar you will be very hungry, so you tend to eat a lot of carbohydrates such as biryani and rice, so it may lead to high blood sugar. So again you have to keep in mind, you should take only limited amount of meals with frequent intervals. Therefore, you will avoid low sugar as well as high sugar. You will keep the sugar at the stable level all the time. And another thing I told you was dehydration. Because of dehydration, why dehydration happens? 14 hours you are not drinking, and remaining non-fasting hours, hardly you take 2 cups of water in the night, maybe 1 or 2 cups of water in the morning. It totally puts to around 1 liter, that's all. But I suggest you must take at least 3 to 4 liters of water or any fluids, tender coconut fruit juices. So that keeps your blood vessels filled. So if the blood vessels are not filled, if the blood vessels are collapsing due to the dehydration, what would happen? There will be a clot formation. The red blood cell, white blood cell all clump together, platelets clump together, causes clot. That clot causes lot of problems like a heart attack, stroke, and kidney problems, and something called deep vein thrombosis, all these things. Especially when you are fasting for over the period of 1 month, nearly 1 month, all these things can happen. So therefore you should take adequate fluid. So my suggestion is you must take adequate fluids, you should take complex carbohydrate and proteins instead of taking only rice, and drugs. There are certain drugs can cause sudden low sugar like glycoside, glibenclamide, glimepiride. All these drugs should be cut down, and there are certain good drugs like metformin and glitazone. We have some recent good diabetic drugs available that you have to consult your doctor. So therefore, if you take care of all these small things and consult your doctor even before going for fasting, and you change your lifestyle during the non-fasting hours, if you change your lifestyle, you will not have problems, and therefore you can avoid unnecessary problems, and hope my tips will be very helpful to you. I find this video message is very useful to all of you, and advance happy Ramadan. If you find this video is useful, please share it and subscribe. Thank you very much.